In this video, I'm going to talk about most common heart rhythm disorder. Um, it's called atrial fibrillation, the most common sustained heart rhythm disorder. Instead of atrium, the upper chamber of the heart, contracting in a coordinated fashion, they quiver and fibrillate. This leads to an irregular and often rapid heartbeat, which can increase the risk of stroke, heart failure, and other heart related complication. So normally the heart electrical signals originate in a spot in the heart called sinoatrial node, causing the atria to contract and pump blood into the ventricle. In AFib, the electrical signals become chaotic in the atrium, overriding the SA node, causing the atria to quiver instead of contracting effectively. The ventricles receive irregular pulses, leading to irregular, sometimes a very rapid pulse. It could be paroxysmal, it could be permanent. What are the causes? Heart-related causes: hypertension, high blood pressure, coronary artery disease, blockage in the arteries, heart valve disease, usually mitral valve problem, heart failure, cardiomyopathy. Could be many reasons. One could be a common one is alcoholic cardiomyopathy, congenital heart disease, prior heart surgery. Other medical conditions: hyperthyroidism, overactive thyroid, chronic lung disease, COPD, sleep apnea, diabetes, obesity, infection, sepsis. Other triggers could be excess alcohol, called holiday heart syndrome, stimulants like caffeine, cocaine, amphetamine, stress, surgery, aging. Risk sharply increases after age 60. Symptoms, usually symptoms are like palpitations, fatigue, weakness, dizziness, fainting, shortness of breath, chest pain. Sometimes patient present with the chest pain, with new onset of atrial fibrillation, then we have to send them to ER to make sure they're not having heart attack. Diagnosis: physical exam, EKG. EKG shows no distinct P waves and irregular R intervals. Sometimes we do Holter event monitor for intermittent atrial fibrillation. Echocardiogram to evaluate heart structure and function. Blood test, make sure thyroid is okay, electrolyte is okay, kidney, liver is okay. Sometimes even a stress test and sleep study. Treatment goal is to control the heart rate, to restore and maintain normal rhythm, and then third is prevent blood clot. How do we control heart rate? This allows the atrial fibrillation to continue but slow the heart rate. Beta blockers: metoprolol, atenolol, calcium channel blocker, diltiazem, verapamil, sometimes digoxin, but digoxin is not commonly used now. Rhythm control, we do it, try to restore normal sinus rhythm. Antiarrhythmic medication like amiodarone, flecainide, sotalol, dofetilide. Sometimes doctor, they shock your heart. They have called electrical cardioversions, and the shock under sedation. Sometimes they need to go through catheter ablation, which destroy the small areas in the heart, causing abnormal signal origination, often around the pulmonary vein. Stroke prevention is the most critical situation. AFib increases the risk of a stroke by 5 times. So patient has to be put on anticoagulants, blood thinner, warfarin, apixaban, Eliquis, or Xarelto, or dabigatran, or edoxaban. We use something called CHAD score to decide who needs anticoagulation. Lifestyle and risk factor management. Got to control blood pressure, got to treat your sleep apnea, control diabetes and thyroid issues, reduce alcohol and caffeine, and lose weight and live healthy lifestyle. So atrial fibrillation is common but serious arrhythmia that requires careful management. The most important part of treatment is stroke prevention with blood thinners if risk factors are present, alongside controlling heart rate and rhythm, and addressing the underlying cause. So thank you for watching.